Hey, lovely people. I'm just excited. I lack words to express my excitement today. Oh my God. I got only today, guys, just today, I've gotten 12 messages of passes in OSCE exam. Well done, guys. I'm just excited for all those who have emailed me today. I've gotten 12 emails. I passed my OSCE Nosvi. Thanks for your help. Please, guys, say it on the YouTube channel. For those who have been able to reply, I've said to you, say it on the YouTube channel just to encourage every other person writing. I'm super proud of you all. In fact, welcome to your Band 5 rules. And like I keep saying, more than the sky is definitely your limit. Guys, trust me. I don't know how, in fact, you don't know how excited I feel when I see people telling me they passed their OSCE exams. Oh my God. Oh my God. Oh, guys, I'm excited. That's just the exact word. So, because of the excitement, somebody sent me a mail yesterday and the person was like, Nurse Violet, you did posted a video on reasons why people fail evaluation. Can you talk about the reason why people fail A to E assessment? Yes, and I think we should talk about that. To be fair, I think we should talk about that because regularly I always get a lot of mails from a lot of people preparing for OSCE, a lot of those who've written, a lot of those who had one or two issues. So I think we should talk about reasons why people fail A2E assessment. I quite agree with the lady or the guy who sent me that mail. I think we should talk about it. So in today's video, we are going to be talking about reasons why people fail A2E assessment. I bet you don't want to miss this video. Now, if you're meeting me for the very first time, my name is Violet Okalacha. I'm a registered nurse. I practice here in the UK, and on this channel I talk about everything to pass your OSCE exam in just one sitting, guys, in one sitting. So if you've not subscribed to this channel, please subscribe, because this is a channel where we talk about everything about OSCE. Yes, a lot of people have followed this channel alone without having any lectures with me, and they pass in one sitting. So this is a channel you don't want to miss. Please share videos with your friend preparing for OSCE exam, because the whole goal of this channel is to make sure every nurse passes their OSCE exam in one sitting. And if you are writing soon, those writing in the month of May, June, I can't wait to congratulate you. Trust me, guys, you will definitely pass. So all you need to do is keep practicing with your peers. OSCE is simple. Nurses are brilliant. Oh my God, I can't wait to congratulate you guys. I can't wait to read your messages. I can't wait to be bombarded by your messages of I passed my OSCE Nosvi. Thanks for your help. We love you. Oh God, I can't wait. So guys, let's quickly talk about reasons why people fail A2E assessment. Now, I don't know how to say it, but I think we should just start from number one. Number one reason why people fail A2E assessment is, now, you know, A2E assessment, the first point is failing from the beginning. Yes, failing from the beginning, because in some centers now, you wear your apron and you wear your glove as you enter. So when you wear your apron and you wear your glove as you enter, and you fail to confirm the patient's details, now assume this is my patient. Hello, my name is Violet. I'm one of the nurses looking after you. Can you please confirm with me your full name and date of birth? And the person tells me my name is Ellie Brooke and my date of birth is 15 February 1940. Can I please double check that with your wristband? Now, you are double checking with the patient's wristband and you are not looking at your paperwork. You're already failing. So when you are double checking with that patient's wristband, you are looking at your paperwork. Haley Brooke, date of birth 15 February. Okay. So you are double checking, looking at the patient's wristband and looking at your paperwork. So failure to do this from the start might be a fail. Yes, I've seen somebody who failed for this reason. I'm not kidding. It's not a time to joke, guys. Yes, she was confirming the patient name and date of birth, hospital number, without looking at her paperwork. So please look at your paperwork. That is one reason. Now, number two reason why people fail A2E assessment is, now, after confirming the patient details, they forget to ask for allergy. Now, if you forget to ask for allergy in assessment, some assessors might fail you. Yes, the reason they will fail you is because it can lead to a drug error. Although you're doing an assessment, but it can lead to a drug error if the patient's allergy is not known. So after confirming the patient details, all right, assessor, I have the right patients. Haley, can I confirm with you, do you have any allergies at all? And so you confirm their allergy. Oh, you are allergic to penicillin. Oh, bless you, my love. What happens when you take penicillin? Oh, you have rash. Can I confirm that with your wristband? That's why you're wearing a red wristband, all right? We wouldn't give you anything containing penicillin. Good. So confirm the patient's allergy is an important part of your A to E assessment. So another thing you want to do is you've told the patient the reason you are there. And for those of you who know me, I always tell you, keep it short. The reason I'm here this morning is because I've come to assess you. Is this a convenient time? I've come to assess you using the A to E assessment. Is this a convenient time? The patient tells you it's a convenient time. All right, I'll leave you with a call bear and I'll assemble all my equipment. If you did not wear glove and apron from your center, do your hand hygiene, put on apron, put on glove, ask the assessor if she's confirmed every of your equipment is ready for use. Now, you start from A. A means airway. Guys, any patient talking to you, their airway is clear. For a patient to have told you their name, to have told you their date of birth, to have told you their allergy, of course it means the patient's airway is clear from you talking. So Haley, I move over to A. A means airway. For your airway, because you're talking to me and we've been interacting, I can confirm your airway is clear. Or are you having any obstruction to your airway? The patient tells you no. All right, so you are done with airway. The second one you want to go is breathing. Now guys, for breathing, I always say use that breathing to do your full set of observation first. Now the reason I tell you is this: the time for A to E assessment is between 19 to 20 minutes precisely. So breathing is respiration and saturation. So if you're doing breathing, you just do only respiration and saturation, and it's okay. I move over to circulation. When you get to circulation, you do BP, you do the pulse, and you do the capillary refill. You will see that you are, at the end of the day, you'll be spending time. If care is not taken, time might be against you. But if when you get to breathing, you do your blood pressure, you do your pulse, you do all the observations, you do all the complete observation. Can I check your hand, please? Have you had surgery in your left hand? Oh, I can see you've never had surgery in your left hand. I'm happy. I take my blood pressure covering 80% of the upper arm, or 2 to 3 centimeters away from the cubital fossa, whichever way you want to do it, whichever one. Then can I do a capillary refill, please? I check your nail beds. There are no false nails. I do a capillary refill. It's less than 2 seconds. I'm happy. I put my probe. All right, can I count your pulse, please? I'll be counting your pulse for 2 minutes. Is that okay? I've counted the pulse for 2 minutes. Sorry, darling, I counted your pulse for 1 minute. I counted your respiration for 1 minute. As I'm doing it, I'm chatting. All right, can I please check your temperature? We all know now that is it tympanic thermometer they are using. Sorry, the one they point on the head that they are using. All right, I can check my patient's skin. You are looking at the forehead and looking at all this area. There is no excessive sweating. There is no redness. I'm happy to take my temperature. You point the thermometer that looks like a gun either on the forehead and you take the patient temperature, or you go to the side. But I think you should use the forehead for easy access. Okay, you take the temperature, then you chat. After chatting, look at your news chart very, very well, guys. This news chart, they mark it. Look at it very well. Make sure the patient's name is there, the patient's date of birth is there, the date of admission is there, and make sure you are charting correctly. If the blood pressure is 140/80, make sure you are drawing that line exactly at 140 and ending it exactly at 80. Make sure you are checking. If the patient is not on oxygen, make sure you are putting that the patient is on air, and make sure you chart correctly. I always say to my students, look at your news chart 4 times. Look at it 4 times, guys. Complete 4 times before, so that you are sure you've charted everything. Because if you miss a lot, is a fail in OSCE exam. Anything you miss in this new chart is a fail in OSCE exam. So make sure you chart properly. So I feel this method of doing all the observation, doing breathing, makes you give enough time for your news chart. So now you have done all the observation. All right, Haley, I've done all your observations. You are having a news of 2 or whatever. I'll monitor you 4 to 6 hourly. I will escalate your care with the doctors and the nurses. Is that all right? All right, fantastic. So Haley, please, I'll move over to breathing now. For breathing, when I did your respiration was 20. There is no stridor. There is no unequal entering of air. there is no visual sign of respiratory distress, there is no use of accessory muscles. I'm very happy with that. All right, and so your respiration is within normal range. So I move over to your saturation. So when I did your saturation, it was perfect. Your saturation is 97, and so you're saturating well on hair, and I'm happy with that. So now if the patient, of course, is an asthmatic patient, and the asthmatic patient is having a respiration of 24, so Ailey, I move over to breathing now. So when I did your respiration, you're having a respiration of 24. That's high. You are wheezing. I think you are breathing. You're using your accessory. Do you feel you're using your accessory muscles to breathe? Yes, and there is stridor, right? And you are coughing. Oh, bless you. Bless you. Don't worry. That's why you're here. You're here for us to attend to you, all right? So your respiration is high. There is wheezing. There is use of accessory muscles while you're breathing, you know? So, but don't worry, we're here to help you, okay? I did your saturation. Your saturation, if it's an asthmatic patient and the saturation is like 95, your saturation is 95. So you are scoring a 1 for that saturation. It's not very good, but like I said, you are here in the hospital for us to help you, okay? So I will escalate it with the doctors, all right? So then I move over to what? Circulation. So if you are in breathing, you didn't say there is no stridor, there is no unequal entry of it. You have to say that you didn't see any visual sign of respiratory distress. You have to talk about it. Not that you say, I've done your respiration, I'm happy with that, full stop. No, there is no stridor, there is no unequal entry of air, there is no respiration. Say what you're seeing exactly on that respiration. I don't know if we get. So because a lot of people are afraid for this reason. If you don't say, if you just say your respiration is okay, I'm happy with that, I move over to saturation is 96. I'm happy. No, there are certain things they want you to a bit elaborate on it. Your respiration is 20. I'm very happy with that because I can see there's no stridor, there's no unequal entering of air. You don't even have to say everything, but just elaborate and let the assessor know that you have an idea of what you're saying. Okay, there's no visual sign of respiratory distress, there's no unequal entry of air, you know, just. And you know, so that's that. So we move over to circulation. For circulation, you are aiming for the blood pressure, you are aiming for the pulse, which is the heart rate, and you are aiming for the capillary refill. So I move over to circulation. So when I did your circulation, Mrs. Ailey, oh, I'm happy with it because your blood pressure is 140/80. That is within range and it is good. So when I did your heart rate, the assessor wants you to tell her the strength, the rhythm, and the rhyme of the heart rate. So when I did your heart rate, which is your pulse, the strength is okay, the rhythm is okay. So I'm happy with that, okay? So your pulse is 90 beats per minute, all right? So when I did your capillary refill, I saw you are properly perfused. There is no cyanosis, there is no painess. I'm happy with that, all right? So I move over to disability. So you have to mention them like this. I move over to disability. So what do they expect of you in disability? All right, so Hailey, can you confirm with me? Do you know where you are? Yes, do you know where you are? And somebody was telling me during her exam, when she got to disability, she was telling the patient, I know you know where you are, and I'm happy with that. And so when they were filling her, she was like, but the patient has told me their name, the patient has told me their date of birth. No, they still expect you to ask. I move over to disability. Hailey, can you confirm with me? Do you know where you are at the moment? Oh, where are you? I'm in the supermarket. Oh, bless you. Sorry, darling. You're not in the supermarket. You are in the hospital, and I'm one of the nurses attending to you. And if she tells you she's in the hospital, you say that's fantastic. So you oriented to time, place, and person. I'm happy with that. Sorry, are you having any pains? Oh, bless you. You are having pain. Is it at your chest? Where is the pain? Oh, bless you. Can you score your pain for me? 0 being the least and 10 being the highest. Who is a 7? Oh, that's serious. I will escalate that with the doctors, okay? Can you take a deep breathing breath for me? Oh, bless you. Can I pop up the head of your bed? How does that feel? And the patient is telling you it's getting worse. Oh, bless you. Don't worry. I'll just finish this A2E assessment and I'll escalate with the doctors and we'll get something, okay? All right. All right. Can I just quickly ask you, how is your urine output? Are you passing good amount of urine? Some will tell you my urine is very dark. Oh, bless you. If it's dark, don't worry, I'll get a sample. You see, so all right, okay, that's fine. So how is your blood glucose? No nurse has come to get my blood glucose. Really? Don't worry, I'll come and check your blood glucose myself. Or how is your blood glucose? The patient tells you it's normal, so that's fine. So all these parameters in disability must be mentioned. You have to mention all the parameters in each of them. Every of the parameters, okay? I move over to exposure. For exposure, I did your temperature, and you are having a temperature of 37. That is fantastic. That is fine. I'm very happy with that. Do you have any wound in any part of your body? Well, nurse, I don't think so. All right, do you want me to have a look? Of course, you know it's an exam. They wouldn't let you have a look. But you just try to tell them, I'm a good nurse that you are. You know, we nurses were so brilliant, so intelligent. Your sister will be looking at you and like, so at every stage, you are telling her the step you are. She'll be looking at you and say, oh my God, how which have known this nurse all my life. This is a good nurse, you know? So, are you having wound in any part of your body? Is there any rash anywhere? Any bleeding anywhere? Any redness anywhere? Any sores anywhere? And the patient tells you, no, it's okay, that's fine. So Hayley, I've completed your news chart. Remember I said to you, you are having a news score of 2. So I'm going to be monitoring you 4 to 6 hourly, all right? And I'll be escalating to the nurse in charge, okay? All right, bless you, Hayley. So Hayley, I will just quickly ask you some questions. Can you quickly tell me, do you comply with your medications? Do you eat well or drink well? Do you smoke or drink? How do you get along with activities of daily living? So you can see, so with this method I gave enough time for my news charts. All right. So now let me tell you the other method people do. They'll do the breathing and do the respiration and do the saturation. So when they go over to circulation, they will do the blood pressure, they will do the pulse. All right, so they will do disability, and when they get to exposure, they will do the temperature. And at the end of the day, the lady said to me, Nurse V, time was against me. So another reason why people fail A to E assessment is time. So I don't know the approach you use. I really don't care, to be fair, the approach you use on this A to E assessment, as long as you finish within your 19 minutes. Yes, I've had one of my subscribers. I wasn't the one who prepared her for the OSCE exam. She just prepared herself, honestly, just watched my video, and she said to me, Nurse V, I practice the method of doing the observation at the breathing, and I finished at 60 minutes. And when I went for the exam, I also finished at 60 minutes. So don't be fixed with any method, to be fair. Just try the one who works for you. So if you try my method of doing all the observations when you are in breathing and you are finishing within that 19 minutes, that's fine. Or if you try the other method where you will do pause, where you will do the breathing, you do respiration and SpO2, then when you get to circulation, you do the heart rate, you do the BP, you do the capillary refill. When you get to disability, so if that is the one that works for you and you are working within the time frame, I don't mind, as long as you pass. What concerns me is for you to pass and send me a message and say, Nurse V, I pass. Okay, so that's the one that matters to me. As long as you pass, whichever method you use, I don't care. Just make sure you pass and you complete everything. You check your news chart 4 times. I'll tell you for free. Somebody failed OSCE and she was crying to me, and it hurts me. The reason, she said, I forgot to write dates. You see these dates are this small column. She wrote the time and she forgot to write the dates. All right. She said, Nurse V, if you had known how I followed you, I wanted to make you proud. I said, don't worry. You will make me proud when you go back for your receipt, so don't worry. So guys, I don't want any of this to be your portion. I've taken time to respond to as many who have sent me emails. It's not easy for me to reply all the emails, but I really try to reply. So I have many who have sent me emails regarding errors in A to E assessment. I hope I've been able to please you. I hope I've been able to answer your questions. So leave in the comment section which of the method you use for your A to E assessment, and tell me how many minutes. For those who are already practicing with their peers, let me know how many minutes you are using for your A to E assessment. All right, my lovely nurses, I love you all, guys. Happy International Nurses Week. I'll see you again in my next video. Until I see you again, keep passing your OSCE exam. I love you all. Bye.